Hi, I'm Dr. Melanie Palm from Art of Skin MD in Solana Beach, California, outside of San Diego, and today we're demonstrating Instalift, which is an absorbable suture lift for the lower face. So in this case, we're going to be doing it just in the lower face of this patient, and the vector of movement we actually want is in this direction. So if you're doing sort of this in the mirror, this is what I think the Instalift is helpful for. It's made out of glycolic and lactic acid. We're going to put 2 sutures on either side. I've made a little entry point with an 18 gauge needle, and then this is the actual needle we'll use for entering. So we go down 5 millimeters, there's a little entry point there, and once I've made that sort of determination and depth, I know I'm in the subcutaneous tissue, and something that's important is we always lock these sutures, so there's actually 8 cones on these, and it's important they're actually hand sewn, and we want to lock them into place. So I'm going to do that right now because they're loosely knotted, but that's going to secure them. And now that we've actually got the needle in place, and I've got it at that 5 millimeter depth, which is right in the subcutaneous tissue, I'm just going to ever so slightly wiggle it towards the ear. And we're just moving just really easily with very little resistance. There really shouldn't be any. You can see the patient is really comfortable towards this exit point that we want right back here by the ear. And so in order to safely exit the needle point, I'm actually going to use the needle hub, and you can see it entered right through there. And then I check my position, and I can see that it's nice and it's sort of in the subcutaneous tissue. If I don't like it, I can go back and readjust again to ensure that I'm in the subcutaneous plane, and then exit again. And I like my position there. There's a little bit of fullness here just from the local anesthetic. And once I've actually done that, I've secured it. And I like that, that's nice and uniform. This is just a local anesthetic effect. I'm gonna thread this through, and then I'll do the same thing. I'm actually going to, once I've pulled this through, and the 4 cones have entered in this way, I am going to let this rest, and we're going to use the other side of this bidirectional suture to go forward in that same way. Once these are secure, then I'm actually going to massage them into place, lifting the tissue up, securing it back here, and we'll be done with the Instalift. And that gives you a little bit of preview of the actual procedure. If you have any questions, you can give us a ring at 858-792-7546, or you can look us up on the web. It's artofskinmd.com.